name is Dr. Oksana Gerwe, and I'm the MBA Health Director at UCL Global Business School for Health. I'm also an expert in strategy. So UCL will be celebrating 200 years anniversary next year, in 2026. And as a large university, it's the largest university in the UK, it's divided into 11 faculties. 4 of these faculties have something to do with health. So UCL is deeply embedded and has always been deeply embedded in health and healthcare. Quite a few of our Nobel Prize winners, and we have 32, come from health. In 2021, in the middle of COVID, a new school was launched, Global Business School for Health. And the idea for this school came from the realization, and COVID again revealed that health and healthcare are the most critical sectors for the society. The economy can't thrive if we don't have the health of the population in our focus. And so Global Business School for Health is basically a school with a monofocus. We are looking at the Sustainable Development Goal number 3, well-being and health for all. We're targeting professionals and executives in health and healthcare sector to give them business, leadership and management tools to address the health and healthcare problems. And we have looked at all the countries and we identified a whole range of problems that are plaguing healthcare systems across the world. And the problems vary, but each healthcare system has some major challenges that they have to address. And the school was set up in a very different way compared to a typical business school. Rather than approach disciplines in a siloed fashion, marketing, finance, strategy, we instead looked at the problems and structured our programs around healthcare problems and challenges. Each of our programs, MBA, Masters, PhD, DBA, undergraduate programs, they all address a specific problem in healthcare, and each solution that we provide combines healthcare disciplines and subjects and business subjects and disciplines. It's 100% business and 100% health, and this is what makes the school unique. So the MBA program was one of the first programs that was launched in 2022, so we are just finishing our 3rd year of teaching. We're growing fast, and the focus is on healthcare sector and the professionals that already have quite a few years of experience in the healthcare sector, and they need the business tools to address the healthcare problems. So the program is designed for healthcare professionals, 3 to 5 years of experience. The average age on the program is about 28, 30. On the executive MBA, it's a bit senior, 7 years of professional experience minimum, but in reality, most of our students have 10 to 15 years of experience, in their mid-30s, mid-40s. And the idea is basically equipping them with business tools to address problems in healthcare. So on the MBA program, about half of our students are clinicians. They come from hardcore clinical background. They're practicing doctors, radiologists, cardiologists, anesthesiologists. A third come from pharma background, and then we have students who want to either pivot into healthcare or they have other backgrounds in tech, medtech, biotech, and they want to expand their leadership and managerial skills. If you look at healthcare sector and healthcare providers in any country, you will see that healthcare is very siloed. They are unbelievably competent. They treat health issues of their population, yet the solutions that they resort to are generally the siloed solutions that you would expect from healthcare providers. And at the same time, business and business education and business practice have come up with so many other solutions that can be applied and transferred to optimize the efficiency, the leadership, the management, the operations of the healthcare sector. And that is why the Global Business School is combining business with health. It's a dual focus, but it's married in a very practice-oriented, experiential way. So you would find all the disciplines that you would expect at any business school, but they're all contextualized and applied to health. All our case studies, all our guest speakers, problems that we solve, everything has something to do with health. And that's why the school is called Global Business School for Health. We do not look at any single healthcare system. We learn from each other. We know that all healthcare systems have different problems and different solutions. So the idea is to learn from each other and have this cross-fertilization. One of the interesting modules that we offer to our MBA students is Global Health Challenge. Halfway through their academic journey with us, we take them to another country. This year a third of the students went to India, a third to Chile, and a third to Dubai and Abu Dhabi. And we spent 2 weeks in that market learning about the healthcare sector there, and then bringing back all the learning and applying it to some topic or theme that students have to address in their research project. In this case, it was public-private partnerships, because in most countries, healthcare challenges can't be addressed just by the private sector or by the public sector, by the government. It's the combination. So we take the students to another country so that they can expand their view of healthcare, learn something there, and then bring it back and apply these solutions to a particular area of investigation that they need to submit for one of their projects. Despite the fact that we're a young school, we have already become the key reference point in the healthcare sector. In a way, we are becoming the Harvard for health. And we are not a young school because we are standing on the legacy of UCL. And many of our colleagues come from different faculties and departments within UCL, and we always leverage for any topic that we may not have the expertise in. We can leverage UCL faculties and departments to deliver that for our students. So yes, we are young, but no, we really aren't. And because healthcare sector is so important for the future and the economic development globally, we think that the opportunities there are absolutely tremendous. If you look at the size of healthcare sector globally, it is massive, and that's why we're quite optimistic. At the conference today, we were talking about the main challenges as the environment is changing, and leadership and management is one of the key challenges that remains across the board, and in healthcare it is particularly palpable. What COVID showed us was that we were not just in a health crisis, we were in an economic crisis and in the crisis of leadership. And essentially this is our mission, to train the leaders and the managers of tomorrow to shape the health for the next generations to come.